everyone, and hope you've had time to meet people and chat over lunch. I'm not going to talk for very long at all. I'm just going to introduce Emily Murray, who's a Senior Research Associate at UCL Research Department of Epidemiology and Public Health. And Emily's going to talk about worklessness in older age, but her wider work also focuses on where people live throughout their lives and how that can affect health and well-being. So I guess you could probably take a few questions on that. And is working on a project to determine whether living in a disadvantaged neighbourhood when you're in early life matters more than other stages of the life course in terms of social advantage and disadvantage. Is that fair, roughly? Anyway, over to Emily to talk about worklessness in older age, and hopefully maybe you can just give an indication of the other questions that you might possibly be happy to tackle. Thank you, Emily.
So I'm on after lunch, so I've got to make it lively, right? So no falling asleep. So as Fran said, I'm an epidemiologist by training, so in public health. But my research has tended to focus on the effects of where people live on their health and their well-being as well. So I like to think of myself as an honorary geographer as well. So that's how it ties in the Stronger Towns as well. And I would say about 5 years ago, I started working on this project called Research into Extended Working Lives. And this is all about looking at the determinants of when people stop working later in life and why they do so. And a lot of that work was on the ONS longitudinal survey. So that's basically my second office is down at the ONS in Pimlico. So if you have any questions about actually how to go about doing the research there and the security and all that fun stuff, then I can answer those kind of questions as well. But I thought I would start my talk with actually how I'm going to end up. So I'm going to present to you, I don't know why it's going, the messages that I would like for you to come away with today, and then I'm going to go back and explain how I got there. So if we're thinking about extended working lives, older people working, the biggest message I want you to come away with is that lots of older people stop working before the state pension age. So when we're talking about extending working lives, we're not just talking about getting everyone who's gotten to the state pension to keep working. We're talking about just getting people to stay in long enough to get their state pension as well. And particularly for today and Stronger Towns, you're more likely to stop working before the state pension if you live in areas of high unemployment. And that this isn't just true for people who leave for sickness, disability reasons. This is also true for retirement outcomes. Because and that health is, speaking as an epidemiologist, health is one of the strongest drivers for work exit as well. But it doesn't entirely explain this relationship that you see between where people live and their work exit. And something you were particularly pointing out is that it's not just about where people live when they're older that matters for their work exit. It's also about where they live earlier in life. So we're thinking about policy decisions. It's not just about doing interventions when people are older. It's about thinking about jobs and where they live earlier as well. So I don't know why it's flipping through. So I'm going to come back to this, but I'm going to say, when I get to the end, I'm going to say policy recommendations for Stronger Towns. I'm going to say it's just, if we're thinking about worklessness at older ages, we should be not just improving employment opportunities for young people. Hold on, I need to think. I think there's some kind of thing where it's running through. I think I've stopped it, but that it's not just about improving employment opportunities for older people. It's about improving them for younger people as well, and that will feed in across the life course into the decisions that they're able to make when they're older as well. And the way that that happens is, one, because they will have better health. They will be more likely to be employed. in middle age, and that this could pay off in social and economic benefits for not just them, but for everyone, in increased tax funding for the Treasury and reduced social care costs, because they are, as individuals, more of them will be healthy, more of them will have jobs in midlife. So I'll come back to this. But I thought, if I was thinking about what can the census tell us, what can the ONS longitudinal survey tell us, I thought I could put it in 3 different ways. So I think it's really good at being able to describe what's happening in the population, because it is a 1% sample as well. And we can use it to explain relationships that we see, and that's what I do, but also use it to inspire other work. So that's how I'm going to go through things. So first, about descriptions of older workers. So as we said, the ONS longitudinal study, a 1% sample, so I won't go through the slide because you've already heard this quite a bit. But I want to point out is that it's not just a 1% sample of the whole census in certain areas of the country. You know, as Rory was saying, it's specifically a sample so that you give equal coverage across the geographies of the country. So as a geographer and someone who's looking at area effects, it's really nice, because what you really need is to get enough people within certain areas to be able to say anything, so that they're representative of the areas that people live. And I think there are very few other studies where you could get enough of a sample size in these smaller geographies to be able to have some confidence in saying that. We have other studies like the birth cohorts, which are really good at following people throughout their lives, but you're going to have like one person per local, very small geography. So it's not really good at representing the people that live there. But if we're thinking about, so for our renewal project, we really wanted to look at, what are the percentage of older workers, so those 50 to 75, who, what is happening to their worklessness. So I think this is good for policy questions of saying, for people at age 50 to 75 at the 2001 census, about 40% of them were still working at those ages. And over 50% were already not working at those ages. So obviously it's going to be more people in work in the younger 50 to 60 age groups as well. But I found this quite striking to think, actually a huge percentage of people are already out of the workforce before you get to age. So in 2001, the state pension age was 60 for women, 65 for men. Now that's both age 65 and going up. But you've already got this issue of, a huge percentage of the population leaving before you even get to the state pension age. And now that the state pension age is increasing, what's going to be, happening to those people in worklessness? And obviously it's about 150,000 people in this survey, so that's a really nice, as an epidemiologist, that's like an amazing sample size, right? And it's not, like, as Rory was saying, it's not just about looking at the specific censuses by themselves, but we can track what happens to the individual people over time. So this is saying, let's look at the work status in 2011 by age group for those who were in work in 2001. So obviously, if someone was, age 40 to 44 in 2001, most of those people are still, in work 10 years later. But when we're talking about these age groups that we're interested in, so people who are in their 50s, basically, so 10 years before the state pension age, approximately 35% are retiring, over the next 10 years, who are only in their early 50s as well. And then that, keeps going up as well. But also what I want you to come away with is that most of the people who are leaving the workforce are leaving for retirement reasons, not for disability and pensions. I think the red line there. So if we're thinking about policies around work exit, I think a lot of times when we're talking about how people are leaving the workforce. Most of the time, it's very few, small percentages that are taking on disability pensions. It's probably much more about retirement as a percentage of what the population is doing. And what I'm very interested as well, looking at geography. So this is, I've flipped this around a little bit. So for those people who were men and women aged 40 to 49 in 2001, this is what's happening to them over the next 10 years. So obviously their likelihood of being in work 10 years later very much depends on their geography. So this is just on a regional level. This is Nicholas Shelton's work. And so it's saying, what we've been talking about today. So those men and women who are living in, still doing this, more southern regions are more likely to still be in work 10 years later than those people who are in the northeast. So just to give you an idea of the descriptions of what's happening is that work exit is very much about geography. As well. Sorry, it's quite warm up here. So I think showing the advantages of the LS, just being able to have these really great descriptions of what's happening across the country in different geographies at the different censuses, and being confident that that is actually representative of what's happening, I think is a really great advantage of the study itself. But obviously, we have these geographic patterns in work exit. We'd like to know, why, what's going on here. So we talk about some explanations. So one of the things particular to thinking about stronger towns is looking at how does the local labour market, how is that related to the rates of work exit. So this figure that I'm going to show is, how likely is someone to leave the work exit for sickness, disability over the next 10 years by the local authority area unemployment levels, so the local labour market. And actually what we have seen is very striking. So on the bottom here we're talking about local area unemployment levels put into 3 categories. So the most, we'll say most disadvantaged communities have the highest area unemployment, so more than 5% of people in that local authority are unemployed and higher. And I think what's really striking is that, so if someone lives in an area with high unemployment, they are 60% higher odds of leaving the workforce over the next 10 years than someone who lives somewhere with a low area unemployment category. And this is adjusted for all sorts of individual factors of age, sex, social class, ethnicity, housing tenure, or health, these sorts of things. So there's this definite relationship between if you live in an area with more unemployment, more likely to leave the workforce over the next 10 years. But what we also wanted to look at was if you want to establish not just an association, but a causal relationship. So if you're in an area where the area employment is going up or it's going down, do you then see corresponding changes in people leaving, more or less as well? Because I think that really gets more to, is there something going on around churn of people? And actually, for people leaving for sickness, disability reasons, we really didn't see a whole lot. So there's some hint that if you live in an area where things are improving, the area unemployment is getting better, that you're less likely to leave the workforce, but nothing around the other way. So if area unemployment is getting worse, are you more likely to leave? So we didn't see that, which was quite interesting from our point of view as well. But as I said, very few percentage of the population were leaving due to sickness, disability reasons. So we also wanted to look at people that were leaving for retirement reasons as well. So this is the same thing here. So you basically see the same pattern, even less strong relationships. So people who lived in 2001 in areas of more unemployment were also more likely to leave the workforce over that 10 years for retirement reasons, not just sickness disability. And I think a lot of this might come from, is that in order to leave work for a sickness disability reason, you have to be quite ill, right? And you have to meet all these requirements and tests and things now. So I'm not saying that health isn't a part of this story, because you could have quite a few people who have health issues, but they're not ill enough to qualify. So they leave for retirement reasons. So that could be one of the explanations. It could also be that, other situations where people have become unemployed, they're made redundant and they can't get back into the labor market, these kind of things. But what you did see for people leaving for retirement reasons is that there was some indication of churn. So if they were living in areas that were getting worse, both mildly and highly, they were more likely to leave the workforce for retirement reasons as well. But what was also interesting is that, before I kind of adjusted away the health effects, but actually there was a really interesting interaction between people's health and where they lived. So it separated out the study into people who were in good health, those in fairly good health, and poor health. So this is self-rated. And if you were in good health, you see this very strong relationship between more area unemployment, more likely to leave the workforce for sickness disability, and the same for fairly good health. But if you were in poor health, actually the area that you lived didn't matter so much. So it seems like maybe there's a certain point where your health status overrides any effect of where you're living, because you're just so ill that you have to leave. So it's not just a story of health explaining the relationship between more poor people that live in areas of more unemployment tending to be more ill. It's an interaction between being ill and where you live and leaving work as well. So that was the major project that we were looking at within the LS. And I thought one thing that came out of the LS work was inspiring another piece of work. And how many people here are familiar with the birth cohorts? Have you ever looked at them before? Okay, no. So there's one of the reasons that I moved to Britain was that the birth cohorts here are amazing. So this MRC National Survey of Health and Development have followed people who were born 1 week in 1946 for their entire lives, and now they're about 68. No, they're in their 70s now. So I think that's completely amazing. And they've got other birth cohorts of 1958, 1970 millennium as well. So they've essentially followed the same people for all these different ages for these purposes until 68. And what we have done is linked those specific addresses in red to geographic data as well. So we could look at where they lived at age 4, 26, 53, 60 to 64, and 68. But I think, and so when we were looking at this different cohort, their retirement status. So when they were age 68, about 80% of them had already retired from their main occupation. But still about 18% were still in paid work at the age of 68, which I think is actually pretty good. And obviously these things vary between men and women. So women tended to have already retired, probably because of the different state pension ages at this point. And men are more likely to still be in paid work. And their mean retirement age it's quite low overall, 59. But I think as more of this group who's still in paid work leave the workforce, that's just going to go up. But this matches on quite nicely to what we saw in the LS as well. So they correspond quite well, which is reassuring. And this is quite a busy slide, so I'm going to take a little bit to explain it. So on the top here we have where people lived at age 4, 26, and 53. So we know what their area was like at those 3 different ages. Whereas in the LS, I was just looking at people who were around age 53 midlife, that relationship between work exit. So whereas the LS was just saying, how likely were you to leave work? Now we're looking at the actual ages that people retired. So we're looking at the relationship between area unemployment age 53 and retirement age. But something we know about migration and geographies is that where people live in midlife, specifically the socioeconomics, is very strongly related to where they lived earlier in life. So if you lived in a poor neighborhood in midlife, you were likely have done that earlier in life as well. And we saw from the LS study that people's midlife health and their midlife employment is very strongly related to their retirement ages as well. But something else we already also know is that where people live earlier in life, so age 26, can influence their health as well. So I think for me there was a lot of questions around, is it really where people live at age 53 that matters for their retirement? Or is that just a reflection of what's happened to them their entire lives, basically? And so we did some fancy modeling, basically, here to look at what is the best model. And basically, you're able to see that, so where people lived in young adulthood was the most important. So if you live in an area with more unemployment as a young person, you're much more likely to develop poor health and much more likely to not be employed yourself at midlife. And then that is feeding into the decisions that you can make around retirement age. So it's not just someone lives in a worse neighborhood in their 50s and that's affecting their retirement decisions. It's that these things that have happened throughout their entire life are leading into what decisions they're able to make as well. But I think it could have never gotten to this point of making this analysis without having done the work in the LS first. So it quite led on to a story. I thought, if you're interested in this topic, the work has been published already in these 2 different journals, and for people that are less don't want to read something so technical, we've written some blogs for the conversation as well. So some nice plain English, non-academic descriptions of what's happened in these studies. And so I want to go back to the messages that we're relaying. So from the LS, we were able to say lots of older people stop working before the state pension age. It's more likely if you live in an area of high unemployment. And it's not just about sickness, disability, retirement reasons. It's people retiring as well. And that health is a strong driver for work exit. So we always hear about that a lot in the news, about trying to make sure people are healthy enough to work, to do kind of adjustments in the workplace for health. But health does not entirely explain why people living in higher unemployment areas is related to work exit. But the point I'd really like to make as well is that it's not just where older people live now, but where they live over their entire lives that is important. And particularly around, the policy recommendations. And I thought this was interesting, I think this was a study in Financial Times early this week. And, I think a lot of times we're thinking about what is the policy implications, what are the recommendations that we should be making around stronger towns and extended working. But actually, if you go ask people what it is that they want, So I think this is Joseph Rowntree and another group did some qualitative studies in areas that had high percentages of people voting for Brexit, basically. And so they said, if you were going to, what is it that you want to happen in your local community? And what they say is they want to have more jobs, and they want to have more skilled jobs, and they want to have jobs for people not going to university as well. So all the things that Stronger Towns is working towards. What I think you might be ignoring is that in order to have a job, in order to do a lot of different jobs, particularly manual jobs, you need to be in good health to begin with, to be able to do them as well. So, yeah, and particularly around older workers and aging of the population. If you want to keep people in work, that they are able to make the choice to stay in the workforce longer, they need to be able to physically and mentally be able to do these kind of jobs. And then that varies quite a lot by geography. And I think that's particularly a place where Stronger Towns comes into, is maybe we need to be adding a health component to the Stronger Towns initiative as well. And also inspiration, so future work that we're planning to do is maybe building into Stronger Towns, is thinking about the health of older people and communities as maybe an asset, a national asset, in order to build these positive social and economic outcomes. So not just thinking as bad health as a negative, but thinking about people having good health as positive and as a way to improve these areas as well. And not just for those particular places as well, but for society in general. So if you think about, older workers staying in the workforce, they're not drawing down a pension or a disability benefit. They're contributing to the Treasury. They are more healthy, so they're not contributing to social care costs as well. So in particular, good health allows people to stay and work longer at older ages. And if you're interested in this kind of work direction, very happy to come talk to me, collaborations, this kind of thing. We could go be down at the ONS together in the Secure Lab. And that they make me put up this slide. So that one is and as well, so if you want to contact me, any further questions or collaborate, that's my email address and Twitter, and this is the amount of funding that goes into doing this kind of work. Thank you.
Well, it is working. Sorry, yes, I'm just going to say a couple of things. Thank you, and obviously, I think I mentioned earlier, if you want to get in touch, don't worry, we haven't written everything down, because there are the feedback forms, and if you want specifically to contact Emily or any of the other people who've been here today, we can help to facilitate that, so just write it on the feedback form. Also, I totally forgot to say, and I was asked to mention about the Twitter hashtags. Please tweet before we... anyway, but any questions for Emily? So, would you like to take the microphone?
I'm Giacomo, I'm from Frontier Economics. Thanks for the talk. So your policy recommendation could be interpreted as the old people, you're kind of sick and kind of that's it, we're going to help the younger people. Is it because the medical conditions that you found were chronic, or were there are there certain policy recommendations that could help these older, unhealthy people in these areas?
I think part of it is that, you're talking about migration patterns as well, is that a lot of people are moving, who are older, are moving to certain kinds of areas themselves. So a lot of the places that you mentioned in your lists, like seaside towns and that sort of thing, will have older people in them. So I don't think it's about blaming older people for being, because they're going to more likely have more health anyway, just because they're older. It's aging. So I think it's more about knowing your population and knowing their capacities, and maybe building jobs around what they can do, and making and so a lot of the places that come up as well, just disadvantaged, left behind places, and are in more northern towns, more post-industrial kind of places, maybe a lot more manual physical labor, which older people can't do. And so I think maybe we should be adapting those kind of manual workplaces for older people, rather than saying, sorry, you're old, we're just going to let you stop working. And I think there's been a lot of company initiatives, I think, around automotive plants who have done that. So I think Ford specifically had these trials of making modifications in the workplace, and they worked really well. And just allowing people to stay and work longer for very simple, low-cost adjustments. So I think it's more like matching up the population that you have with the jobs, rather than just saying, here's your jobs, sorry, forget about it.
Anyone else? No? Okay. Well, thank you very much. Oh, sorry.
Just really wanted to say, I think it's really good, this idea of following from people where early in life. And I think, certainly the more that kind of research that's around, I think is really useful, both because it tells us a bit about, how these things do trace through your life. But equally, as you said, we all tend to fall in the trap of kind of associating current outcomes with, blaming up, when we think about outcomes and the place, they assume that it's kind of static and the people have been there all the time, etc. And I think it's the lack of this kind of analysis that allows that to happen. So really it was just the kind of, just to say, it's good to see this kind of work going on.
Thank you. I think I could say we've looked at the birth cohort, so the 58 and the 1970 cohort, and tracking much more like how much does where you live, track across a lifetime, and it's hugely high levels of tracking. So I think if you're born into an area that's more deprived, you're much more likely to be stuck or in that area your whole life. And so if you think about, for me, we see these effects of where people live on their health over their entire life, and it seems like it accumulates over your life. So in a way, are you supposed to blame people for randomly being born in a certain place and that they just couldn't get out of it? So there's that kind of thinking. So I think, it is very easy to blame someone and be like, well, you live in this deprived area, you should have moved, you should have gotten yourself out of that. But actually, it's a long progression of the choices that they were given or born into as well.
Anyone else? No? Great. Well, look, thank you so much, Emily.